Welcome to the Lindsay podcast show, where weekly I interview some of the world's most inspiring people from business, philanthropy, and entertainment. I love collecting humans, and these are some of my favorites I found along the way. This podcast has been brought to us by Capita Financial Network.
Do you need help with the next steps of your financial plan? Think Capita. Capita is a financial network built around you. They have a team of financial advisors, CPAs, estate attorneys, Medicare providers, and Social Security experts to help you accomplish your financial goals. Call or schedule a complimentary consultation at 801-566-5058 or visit their website at capitafinancialnetwork.com. You can also check out their financial education podcast, The Financial Call, available on Apple, Google, Spotify, and YouTube.
Today, I'm so pleased to introduce my friend and an absolute force of nature, Echo VanderWal. I met Echo while traveling over the last 3 years to the beautiful, tiny little country in Africa called Eswatini. Eswatini is, for many people, formerly known as Swaziland. It's just north of South Africa, and she's running a phenomenal hospital there, one that will blow your mind when we talk a little bit about it, called the Luke Commission, where she's servicing literally a third of the entire country's medical care for an absolute fraction of the price. I can't wait to talk about her professionalism, the harrowing journey she's been on, and share what she's trying to accomplish in this tiny country that has been absolutely pulverized by the epidemic of HIV and AIDS in the 90s. So we're going to talk a little bit about that, her family's amazing story. And Echo, thank you so much for coming on the show.
Thanks, Lindsay. Thanks a lot.
Okay, so Echo, why don't we start off by share with us what got this amazing, medical professional lady from America to move her husband and her entire life and then have children and stay and live till her dying days in a little country in Africa that most people have never heard of, let alone visited. What was the story to get you what you're doing? And why you are where you are?
Well, I was actually a kid when I felt called to go overseas and work in Africa. I heard someone speak when I was 8 years old about working in the Congo, and they talked about how there was so much medical need, but there was not people there to do medical work. And so when I was 8 years old, I felt called to do that. I know it sounds crazy, but what was really helpful for me is that my parents didn't make me feel crazy. They always said, the sky's the limit, do whatever God calls you to do. So when I was all the way through high school, I still felt called to do that. And then I went to university and I met my husband, who, when he was 17, he also had a similar calling. And I think we initially fell in love with having the same calling and then with each other. And then we got married when we were 21. We went to medical school. He's a doctor specializing in internal medicine and pediatrics. And I went to PA school with a background in surgery and pediatrics. And then when he was finished his residency, we came to Eswatini. At the time, actually, when he was in medical school, we had triplet boys. And then we had our fourth child. The first time we had an opportunity to go overseas was in 2004. And actually, that was when we got our first passport. It was the first stamp on our passport. We came to Eswatini. And we had a 2-month-old baby, and we got off the airplane, and somebody took us straight to a rural area. And at the time was the height of the HIV pandemic, and there were people literally in every home that we went to that were dying from HIV, young people in their 20s and 30s. And so we decided that we would like to come back and serve in Eswatini. Of course, we were going to a country we didn't know, that we didn't belong to initially, and so we didn't know how long it would last. But actually in September 2024 will mark 20 years being in Eswatini.
Incredible. So you land there, you fall in love with the people, but tell us a little about the condition that the country was in that drove you to start the Luke Commission, a hospital that was privately ran, largely funded by philanthropists yourself. I mean, one thing I really admire about Echo is there are a lot of operators in the nonprofit space that kind of consecrate all their time, all their energy, the opportunity costs of what they could have pursued in the private sector to make a lot of money. But with Echo and her husband, Henry, I mean, they have put every last penny of their inheritance, their 401k, their home, their mortgage into saving lives. And I don't know anyone I've ever met that is more all in. And the competence that they both display, like Echo, you guys could be running Fortune 500 companies in America. You guys are so high capacity. tell us what got you to be all in, and like maybe how it started out, this kind of hero's journey, so to speak.
Well, if I reverse back a little bit to childhood, I actually grew up in a family that was poor, but we didn't know we were poor because my parents never acted like we were poor. But I do remember really struggling to get access to healthcare. In fact, my sister right under there was four of us, and my sister right under, she almost died when she was 15 because we didn't have medical insurance, and she couldn't get into the hospital. And by the time she did get in the hospital, she was in a coma and almost dead. I've experienced that firsthand. And I also know what it feels like to be poor because you're usually not recognized, you're kind of unseen. And I don't know if that played a role in it, but definitely when I went to the rural areas of Eswatini, because I grew up in northern Idaho, and well, anyway, there's bad roads there, and a lot that of kind of roughing it. So Eswatini wasn't that different when we started going to the rural areas, but what was very different is that where people were dying everywhere, as I mentioned. And the really sad thing when we first came is you couldn't even test. There was no testing commodities for testing for HIV. And I felt so terrible. I remember the first day that we went out, there was someone we took care of and they died the next day. And I was like, oh, they're going to blame us or whatever. It wasn't like that at all. People were just so grateful that you came to them and you made an attempt. But for the first 4 years or so, there wasn't testing commodities. In 2008, we finally got testing commodities, but there still wasn't medication in the country for HIV. And I remember near the beginning of when we were working in Eswatini, we were testing 250 people a day positive for HIV. And I can't really explain to you, Lindsay, what happened to my heart in seeing that kind of suffering, because I recognized that for every adult that dies, they are leaving between 8 to 10 children behind. They weren't only taking care of their own children, but they were also taking care of other family members' children who may have died or otherwise. And it was very we felt like God laid on our heart that it was our job to go into rural areas and make sure people had access to care and treatment so that they could live to raise their own children. There was a calling to delay of orphanhood. And while we know that children's home are very important, we really felt that on the continuum, it would be best if parents could live to raise their own children. But in order to do that, you had to make healthcare accessible, because what we found in our early days, and for the first 8 years, my husband and I, we're a large team now of 700, but in the early days, it was just my husband and I, the only medical professionals, and about 20 local staff that we worked with. And so we went everywhere. We have dust on our shoes from every chiefdom in the country, and really probably know the country like the back of our hand. And we learned so much during those 8 years because we learned what the barriers were. We learned the stigma and how it impacted the family life. And yeah, our hearts broke, even though we didn't feel overwhelmed to the point of like being paralyzed, but you did feel a real motivation to step in the gap for a nation that literally at that time, they were saying there was something drastic didn't happen, that by the year 2030, this nation would be considered statistically extinct. And you just couldn't believe for a second that was God's plan for Eswatini. So, in those beginning years, while I can say things were very difficult and kind of on the edge of the cliff from a medical perspective, very emergency orientated, and a lot of people died. I remember when we first started getting testing commodities, or we first started getting antiretrovirals in the country to treat HIV. As I was saying, we were testing 250 people a day positive for HIV, but we only had enough medication to put 5 of those people on antiretrovirals. So, when you think back on it, at the time, somehow you just moved from day to day and stayed encouraged. But when you look back on it, you recognize that, it was a pretty disastrous situation, but I'm really grateful to be able to look back on it and see that things are different now. Of course, we have new challenges and things that need to be worked on now, but definitely not the same as when we first came. I can't really explain. It's just like God got a hold of our hearts, and he said, I want you to be here, and he's never taken away that calling. And until he does, we cannot move from where he's put us. So,
oh, your faith is so unbelievably inspiring to me, Echo. And, I hope you feel a lot of love and support from people. I hope you know how people perceive you and see what you guys are about. You are a true leader and a revolutionary when it comes to love and running towards suffering. Um, I remember you telling me a story. You've had your children deeply in the mix. You told us a story about how they were involved in very high risk situations, both um, in a medical sense and even in sanitary sense, in a sense that just the exposure your kids had because you guys were all on deck. Maybe you can share a little bit about what that was like, because that really seared into me some of these experiences that, I mean, you weren't just like a mom going to work every day, helping other people. Your whole family lived and breathed, the conditions and heartbreak that surrounding you.
Well, as I mentioned, when we first came, we had triplets that were 3 and a 2-month-old. Those are all boys. And then after we had been here for about 10 years, we had a girl. And then a couple of years later, we had a boy. So we have 6 children in total. Our oldest son is now married to a Eswatini, and we have a grandson who just turned 1. So they've really been a blessing. As you mentioned, from very early on, we recognized that if we left them at home and we went out to a rural area where typically we're taking care of about 500 people a day, and we committed to the communities that we wouldn't leave until everyone was taken care of. In fact, it's been a slogan for ours from the beginning, every last one, because we recognize that people, once they sit in that line to see a doctor, if you leave them, it's so heartbreaking for them, and you also break trust. So we decided that we would stay, which means sometimes we would stay till 8 o'clock at night, 10 o'clock at night. It was not unusual to stay till midnight or 2 in the morning, especially in the early days when Harry and I were the only medical people. But we decided that if we left the kids back at where home was, that if there was an emergency there, how could we focus, because they would be in one place, but we would have these lines of people waiting in another place. And so we decided just to embed the kids with us. They traveled with us every single time we went out, and they did video school. So they would have to do school in the bus, bumping along on the dirty roads. And then once they got there, they didn't get off the bus till they were done doing school. And then once they got done school, they would come and start working with us. And I'll be honest with you, Lindsay, I don't know that I stepped back to think too much about how it was going to impact them. It was just our life. But boy, when I see them as 23-year-olds who have this calling also like just embedded in their tapestry in a way that I can't describe. I mean, they understand the culture better than we did because they grew up here during their formative years, and they lived and breathed the hardships and the suffering that we saw. But the way that God used those kids to bridge humanity was such a blessing to us, because when we first came to Eswatini, the stigma was terrible. They thought that if you got HIV, that if you lived in the same house, you would contract HIV. People were so scared about the way you contracted HIV. So I remember literally people like sleeping outside once they would get diagnosed with HIV because their family would just keep them out of the house. And what would happen when our kids would come there, because, obviously from medical standpoint, that way of spreading HIV was not, quite accurate. Obviously there is some risk, but our kids would just run around and play with the kids. And there's something about children that it's, the all nation equalizer. It's like nobody's different when kids are playing together. Kids are just the same, no matter what country you go to. And they have a way of making friends and interacting that we don't adapt to so easily as adults. But when the community saw our kids just touching them and not being scared, it was like this subliminal messaging. So there were so many ways that we saw the kids having an impact on kind of the root issue or the root calling that we had, which was to make sure that people are on medication so that they could live to raise their own children. And the kids bridged those relationships and relationship building processes for us. So then they have, really been involved in the ministry since then. Of course, it's changed over time. Initially, I'll be very frank with you, we needed them to help us because there was so much work that needed to be done that they filled major roles when we only had 20 people on the team. And it's different when there's 700 people on the team, and it's, pretty highly sophisticated from a structural standpoint. But yeah, they're really precious memories to think back on, just being able to have those times together and thus far, they have not expressed any resentment of that. In fact, we had this long gap
Wow.
between the first four and the second group of two, and the four boys sat us down initially, and they said, "Listen, we want to know now that you're not doing the same thing you were doing when we were little, how you're going to make sure that these two younger kids are able to be implanted the same understanding of the calling, like almost like parenting us, how would we instill that in the
Wow.
kids?" So it's been a real joy to work with them, and I definitely didn't expect them to stay in Eswatini, but they have thus far, and it's really a blessing to have them around.
I've had the privilege of meeting some of your sons, and they're all they have such decorum, such a mantle of love and spiritual leadership in them, and you've got to be so crazy, ridiculously proud. I'm amazed at their fortitude and their generosity. And fast forwarding all these years later, and under yours and Harry's leadership, TLC now boasts of over 700 staff members. Is that right? And then you're providing services to over 200,000 patients a year, and have 40 different types of medical services that you provide. Am I getting those stats right, Echo?
You're almost right, Lindsay. It's pretty good. It's last year was 300,000 people the patient visits that we hosted last year. And yes, things have expanded, as we've seen need on the ground. We've tried to solve more complex problems. So while we were doing mostly community health when we first came, and we did some kind of complex care, but we didn't have a hospital at the time. And then in 2013, we were able to buy a piece of land in the center of the country, about 150 acres. It was just a farm at the time. And since then, our local construction team has built about 25 buildings. And we've been able to establish a hospital there, which has helped a lot. So now when we find complex cases, we have a place to refer them. And the team's just done an amazing job. We have about 25 doctors on staff now and several specialists. And one thing that I'm really excited about is that for many years, there was a gap around orthopedic care, mostly because the rods and the screws and those kind of the hardware was really hard to get, and it's expensive and difficult to manage. And our team made a commitment in 2021 that they would start an orthopedic program. And boy, when you see what they've accomplished in this time, we started last year a hip replacement program and have done 42 hip replacements. And in October, they're going to do their first knee replacements. So we're really grateful to have doctors coming in from Texas and North Carolina to do the training, but they work with our team on the ground in Eswatini and then capacitate our team then to be able to stand alone and do these procedures. But I'm just using that as an example where you find complex issues, and we're really blessed by the team that finds ways to solve them. So it's interesting. We're doing hip replacements on a lot of young people, like 14 years old, 17 years old, people in their 30s, not the same demographic as the United States. And so, yeah, those massive changes in their lifestyles after they're able to get the gift of mobility for many, many years is really amazing to see. So it started simple when it comes to healthcare approach, but has gotten quite diversified and specialized over the years.
I'm so amazed by your guys' growth and your continued commitment to your team. I've seen how they love you. You guys are like a family. I've been able to see your facilities, unbelievably gorgeous. Let's talk about the COVID-19 pandemic, Echo, because I know that you guys had some harrowing, unbelievable experiences during that. First of all, you were completely short of oxygen, as most of the developing world was. I mean, all the world was struggling with oxygen demands, but in sub-Saharan and East Africa, I mean, it was non-existent. So you actually did something radical, and you actually created this innovation with creating your own oxygen production plant. Can you talk to us a little bit about what that was like? I mean, you've mentioned these just trailers of bodies, and that unfortunately, maybe you can speak a little bit about how you were demonized in the media because of your no one left behind, that every single last one, that you would actually not turn anyone away. Why don't you share us a little bit about what that was like?
Well, maybe I can, because I know there's, it's also a place where you are are working in, but maybe it can paint a bit of a financial picture for us, because before COVID-19, we are a very lean organization, really careful with how we expend funding, and we didn't have any debt before COVID-19. That has drastically changed for us since COVID-19. Maybe just to put a little bit of a, underbelly of what's happened, not just from a response to COVID-19, which I'll explain in a minute, but also drastic change financially. Maybe also just to reverse a little bit, you had mentioned this, that when I had the triplets and Harry was in medical school, I decided to start a real estate development company. And that's the seed money that we actually used to start TLC. So it's always been something we've talked about as an organization, and we keep front and center that we spend what money people give us like it's our own. And I think that changes the dynamic. But prior to COVID-19, in a very good financial position, even though we had done a lot of building, we had really been able to build with cash and keep our books without any debt. But let me paint a little bit of a picture of what happened when COVID came. We've kind of sat back as Southern Africa and watched bird flu and other things happen like that, and you kind of watch from far away, and they never made it to us. But there was a point in March 2020 when we realized that COVID was not going to skip our country, and we started preparing. In fact, on the 25th of March, they closed our borders. If you can imagine a country the size of New Jersey closing the borders, and our nearest neighbor, South Africa, is where we get most of our commodities. So now you're getting cut off from trade and bringing in supply. So the first thing we did, knowing this dynamic, at the beginning of March, we had kind of figured out that they're going to close the borders. So we put actually a war room together of procurement people to bring in as many goods as we could and stockpile, so that when COVID came, we would be ready. And so we did that. And then in July of 2020 is when the first COVID wave came. Now, no matter how much you were prepared, you were not prepared for watching people suffocate to death. During the first wave, we're mostly learning the disease and figuring out what we needed in order to combat the disease. We did not have a shortage of oxygen in the first wave. But in the second wave, on the 11th of December, 2020, we had 16 critical admissions in 4 hours. And it was a Friday night. And I thought there were other hospitals that were referring patients just to decrease their census on the weekend, because that often happens all around the world. And very quickly, I realized that the second wave of COVID was coming in, and it looked very different than the first wave. Number one, the volume was much higher. And so about 5 days in, I realized that the amount of oxygen we were getting was not, the supply and demand ratio was not healthy at all. So I called basically every person that I could in leadership in the country, including the prime minister, and told him that if we don't do something drastic, we're going to lose our people en masse, because there's not enough oxygen coming in from South Africa. One of the things that was allowing us to know that is that we have a digital system that we've built over the last several years, and it was measuring the amount of oxygen people were consuming. And we could see from that we only had about 50% of the oxygen that we needed to sustain the people who were alive. And that only worsened through the month of December, to the point where at the end of December, there was literally like no oxygen. It was really horrifying, Lindsay, because people would be talking to you and saying, like, I'm going to die, and 5 minutes later they'd be dead. And there was nothing you could do to stop it, because you didn't have the one thing you needed, was oxygen. So we decided the first week of January that we needed to do something drastic. And obviously, procurement of oxygen production equipment was really tough then, but we just felt like we had to make a commitment that by the third wave of COVID, we would have our own way to generate oxygen in Eswatini. The words that we heard, we really feel this was from the Lord, was that we needed oxygen independence as a nation, that a nation should not be dependent on any other nation for something such as oxygen. And oxygen became the new water. It was like this shift where even water was not as important as oxygen. And so we met as a team, and then we made a decision that I was going to go to the board of directors and ask if we could we had a line of credit for emergency use only, if we could use that line of credit to pay the deposit to start an oxygen plant. So we did that the first week of January, and we installed all the pipes into all of the buildings. And 6 weeks later, we hooked up to a temporary liquid oxygen tank from South Africa. We were still dependent on South Africa, but that tank was the equivalent of 2,000 cylinders. Let me tell you, moving cylinders from bedside to bedside, which was the only delivery method we had for oxygen in the whole country until that liquid oxygen tank came in, is horrifying when you have people who sometimes need 100 liters of oxygen a minute to survive. Those tanks, ventilators, they would only last for an hour and a half. So we then shifted to the liquid oxygen tank, and that allowed our team to go down and start building just to back up. During the time we were using cylinders, we had 12 people on the night shift and 12 people on the day shift. All they did was move oxygen tanks. Our IT technicians, very skilled people in our organization, came and just managed regulators. We brought in technical people from all the different divisions to backfill so that the nurses and doctors and other medical professionals could do what only they could do. And it was really like a wartime setting where you just backfilled on the front lines of a battlefield. And the team's commitment to unity and to working together and to being flexible and agile really played a huge role in saving a lot of lives. But we had to change the oxygen equation. So as soon as they hooked up to the liquid oxygen tank, they went to start to build the plant. And it was when I reflect back on this, it was one of the most amazing things I've ever seen in my life, because the same people who were moving oxygen cylinders were the people who went down to build the plant. And they were working every single weekend, every single holiday. During that period, we had 5 holidays, but every holiday I would look up there and they were working. And they were working late into the evening, and sometimes they're working overnight. And I asked our construction manager, like, why are people working? Because I didn't see a memo to tell them to work overtime. And he said to me, Echo, by the 3rd wave, this plant will be finished. To see the tenacity of that team and commitment to making sure that no lives were lost unnecessarily was just amazing. And then they finished the plant just 20 days before the 3rd wave started. And that was the first time that Eswatini had ever produced its own oxygen inside its borders. And then 3 weeks later, the 2nd wave came in. At the same time, we had unprecedented civil unrest. And every single city and town in the whole country was on fire on the 29th of June, 2021. And then we started getting calls from from the Ministry of Health to go take and evacuate people out of other hospitals, because the nurses got scared once the burning started in other hospitals, and they left the hospitals, and the patients were there. So we went and evacuated those hospitals. And then because they were burning fuel trucks that were coming in from South Africa, force majeure was enacted on all the oxygen contracts that were coming from South Africa. And so no oxygen was coming in from the country. And this plant that had just started producing oxygen for the first time a few days before was the sole source of oxygen for 2 weeks after the civil unrest came. So when I think back on that, it still gives me chills, to think about the timing and how things happened. And this changed things drastically. In the 3rd wave, you talked a little bit about the press. Before I go to having as much oxygen as you want, it was difficult because there was some desire to make government not look good, or there were some groups who wanted that to happen, and we were kind of disrupting what they wanted to see happen to the government. And as a result, they were using social media, kind of as a weapon. And I met with our team and just asked them, like, what do you want to do? Because outside there, really things are very difficult from a media perspective. And every single one of the people on our executive team said that we will not turn one person away, because we had made a commitment in our first days here that we would take care of every person like our own father, mother, brother, sister, child. And so can you turn your mom away if you don't have the one thing she needs, which was oxygen at the time? There's no way any one of us is going to push her mom on the street. So we accepted every ambulance that came in. And what I can tell you looking back is that we don't have any regrets. And boy, am I grateful we don't have any regrets, because that would be something that you might not recover from. But then in the 3rd wave, we had as much oxygen as we wanted. And we were able to just give people oxygen like freely. It was such a change. And the case fatality rate fell by 50% in the 3rd wave as compared to what it was in the 2nd wave. It was really amazing to see what happened as a result of not only having oxygen, but having people that were willing to do the hard work, because all of those resources don't matter if there's not a team willing to do and step up to the things that are really difficult to address. So yeah, it's a story for a lifetime.
Amazing.
I can put it that way.
Well, and you guys were true, actual living heroes. But in addition to that, like that's what kind of also puts you under incredible financial stress. Maybe we can talk a little bit about, the financial stress and why you guys are in such need of support, including, I don't know how much you can get into the dynamic of government. When I mentioned that you're servicing a third of the country's medical care, just for context for our listeners that are almost all in the US, it's around $20 million a year operating budget. Is that right, Echo?
It's a little bit more than that. Yeah. Yeah. I mean, comfortably we would be at 35 million. We're about at 23 million right now.
Okay. So they're way under budget. They're operating under budget, super lean. People go without paychecks. It's just not normal life. People are so like on mission and so dedicated, but it's not sustainable, and it's very, very difficult, and it's strained Echo and her family's resources as far as they can go. But on the contrast, the other 2/3 of the country's medical care is facilitated through USAID grants, government taxes, and resources, and it's around 500 million for the other 2/3. So am I getting that about right? The disparity and like how you're doing for a fraction of the price for 20 million, a third. So even if you let's call it 23 million and triple it, you're looking at a $60 million versus $500 million spend if you were comparing apples to apples. Am I getting that kind of on point?
Yeah, it's almost there. The exchange rate's a little bit different, but because the gap is so huge, I don't think we'll have to correct that too much. But I will be as transparent as I can be about what's happened on the ground. We've had an issue with drug shortages. Literally, like, we have one of the best healthcare budgets per capita in the whole continent. But for years, even prior to COVID, we did not have the medication that should be in the government hospitals or in the public hospitals. And we know personally, because we do receive, as part of our MOU with government, we have access to central medical stores, and we get 16%, 1/6 of what we requisition from central medical stores. So, through pure data, we can see that if we're not getting it, surely the government hospitals are probably in the same position. That makes it very difficult because we have such a high unemployment rate of about 30%, and people count on government hospitals to go to when they're sick, and they don't have money probably for much more than transport. So when they go and then they're told to go to the pharmacy and buy medications, it's just a deal breaker for people to actually be able to maintain their health. So we are losing people unnecessarily because of our supply chain challenges in the country and supply chain accountability and transparency. That is very well documented, things that have been, unfortunately in the press for about a decade. And it was there before that. It just wasn't as obvious. When COVID came, of course, there was a lot of funding that came into the country, and it kind of masked the problem. And when the COVID funding receded, the problem was actually accelerated and much worse than it was before COVID. In fact, we've had stockouts of some basic HIV commodities and TB commodities, which never happened before COVID. So there are some fractures that are really, really, really disturbing when you consider the fact that 20 years ago, we were in such a difficult position when it came to HIV, and we're at risk of losing those gains if something doesn't change drastically in supply chain. How does that affect TLC? So now, if you go to government hospitals, you don't find drugs. But if you come to TLC, where we have built this digital system called the Velo, that is a very robust end-to-end supply chain accountability system, we always have drugs. So if you have a choice where you're going to go in the country, where are you going to choose? You choose the place where there's reliable supply chain. And that's what's happened. The number of people coming to our institution has grown from 5 years ago as 50,000 people a year to 300,000 people a year. That's a massive, unsustainable growth curve. One of my advisors calls it a hyperbolic explosion. And that's what it looks like when you look at the data. What was very
Yes.
difficult for us is because for the first 17 years or so that we were here, we did not turn anyone away. If somebody came to us for healthcare, we found a way to help them. And unfortunately, with the volumes that are here because of the supply chain challenges at government level, we have had to start not seeing everyone, which has been, very, very difficult. As you've mentioned, many months our staff have missed salaries that never, ever happened. Lindsay, we were very careful to protect salaries. That's like number one, kind of not penetratable space. And I've given the staff every opportunity that if they feel like it's best to go home, that they're free to do that and they continue working. And it's literally heartbreaking when you walk around knowing that their kids might not be eating because they're working and continuing to press forward. On the flip side, we've spent 20 years trying to instill a culture of taking care of other people like you would your own family member. So even when things are difficult, you don't walk away from your own family member. And that's what I've seen from the team. What has been really difficult, and I'm, very grateful because uh, some of our leaders in our country from the highest level are pushing for this to be changed. But during COVID, we did not get considered for a lot of the COVID funding. In fact, global international partners were asked to build oxygen plants in the country. And when they submitted those grant applications, they did not even disclose that we had built the biggest PSA oxygen production plant in the continent. So, and unfortunately, these global partners contributed to these projects without full disclosure, and those projects never progressed. They've never happened. But it diverted funding that probably should have come to TLC. If you look at everything at
Absolutely.
it should have come to us. And so as a result, then we had to take out loans, as you've mentioned. We have loans for the first time and have gone into considerable debt just to course correct from what happened on the ground in Eswatini during COVID. And,
Right.
barring a miracle, it's probably going to take us 2 to 4 years of, some pretty significant cutbacks to be able to course correct. But I don't know. It's like, through every trial, there are things you learn and you grow. And, our team is a team that is solutions focused. And so we're, looking for what we can learn, how we can grow, and how we can diversify. There's a lot of interest from other countries in some of the innovations that we've built in Eswatini and have been developing over the last several years. And so we're working to diversify our revenue streams. That will take time because we were very focused on Eswatini. Eswatini was the apple of our eye. It was our first love. And it was very difficult for us to make a decision where we were going to diversify to other countries. But that's what we're doing now. And so, hopefully in the next 2 to 4 years, we'll be able to course correct from what happened during COVID.
Echo, thank you for sharing that. And there's some really hopeful things on the future. I'd love for you to briefly describe Luvelo, just, for our audience. It's a technology platform that Echo and her team have developed that allows for some of that supply chain and transparency and data information that currently isn't available, not only in Eswatini, but on the continent and maybe all over the global south. And we believe there's some potential to monetize that through a software as a service. There's a lot of listeners on the Lindsay Hadley podcast show sponsored by Capita because we have a lot of entrepreneurs and tech professionals here in Utah. We call it Silicon Slopes, which is kind of a play on words for Silicon Valley because we have the most per capita tech unicorn exits in the world. So we really understand tech and SaaS. If there's anybody listening, I'm just shameless plug, would love help and connections. This is where you could use your ability to scale, monetize, do enterprise software, anything like that, that could really make them one of the more sustainable and economically viable nonprofits in the world, in my estimation. So Echo, maybe you can share a little bit about Luvelo.
Well, thanks a lot. Luvelo means compassion in Siswati, so that probably is not too shocking to anyone. But we also felt like it was something that could easily be said around the world. And as much as I just shared a very difficult story of COVID, I can tell you something that grew like wildfire during COVID was Luvelo. Because every time there was a challenge, we built a solution, a digital solution, and allowed us to exponentiate the impact, even despite the difficult situation. But we started about 7 years ago just developing digital solutions for our own pain points. We really never thought about it being used outside of TLC, but over several years, people started asking, and entities and other governments and countries started saying, would you be willing to export this? And we knew that we would have to put it on a much bigger platform in order to do that. So the last 2 years, in a rapid migration process, we have moved everything from its original small platform to a large platform, and it can manage millions of simultaneous users. We say it was piloted in Eswatini and it's scaled for the world, and that process is really essentially done now. But I can tell you that there are things that are in Luvelo that never would have been there without the heartache of the past several years. In fact, I remember during COVID, some of us that were working in administration, all of us went back to the hospital because of the needs there. And so I would be in there and working on a patient, and I would see out of the corner of our eyes some of our developers who would be in there with PPE with us and watching what we're doing, watching our time and motion, and they would go out. And I remember about 2:00 in the morning one night, I walked around the corner and one of our developers had his laptop on a trash can, and he was coding something that he saw while he was in the war. And 30 minutes later, we were using this rapid response module that he built to save more lives. And that module is still being used in our ICU. And, I have experienced personally during COVID as a user, an end user, how impactful the system has been to not only saving lives, but stretching resources and maximizing resources. So we're really excited to be at the point where we can take it to the rest of the world. We have had some interest from other SADC countries, Southern African countries, and have had opportunity to be able to speak in several different continents. But definitely, it needs to take a major leap now that it's ready for export. So yeah, I really appreciate the opportunity to be able to share that piece, because it's one of the bright silver linings from some of the more difficult situations that we've gone through. But it's a diamond for sure.
You do. You have something very magical.
Yeah,
and I loved your point. Yeah.
Go ahead.
Go ahead.
No, go ahead.
I was just going to say, I loved your point about it was born from such harrowing, terrible, painful situations. Like, there's something very precious about that we can look back and see the silver lining or the fruit that comes from suffering at times. Echo, you're just one of my actual heroes as a person in the world, and how you show up and what you've accomplished and how you're doing it. I just admire you so much. How can, kind of to wrap this up here, like, how can people connect with you if they want to make a donation, invest, or get involved with Luvelo on a social impact perspective? Luvelo, if they want to help you get, like support to more medical professionals to come over, or in-kind contributions, or whatever it may be, like, what are some ways people can help, number one, and then how can they connect with you?
Well, thanks a lot, Lindsay. You've mentioned a lot of the ways, and I really appreciate talking on a platform where they understand scaling tech and, the investor process that needs to happen there. So that really is something that we're very focused on, because we really feel that will give us the agility and flexibility to navigate and continue to serve in Eswatini and beyond Eswatini. But aside from that, if anyone would like to reach out to us, you can go to Luvelo, LUVELO.org, or lootcommission.org, or you can use info@luvelo.org or info@lootcommission.org, or you can reach out to Lindsay, because she has WhatsApp and
that's right.
every other form of communication.
That's right.
So we talk frequently on a regular basis, so you can definitely reach out to Lindsay. But we really appreciate the opportunity to be able to share about what's happened in Eswatini and the mountains and valleys. And we're really grateful, Lindsay, to you and your team for investing in Eswatini. Thank you very much.
Oh, it's our pleasure. Thank you for coming on the show, Echo, and for just the incredible, huge powerhouse of a heart you have. We just love you. Thanks so much.
Love you too. Thanks, Lindsay. Thank you.
Do you need help with the next steps for your financial plan? Think Capita. Capita is a financial network built around you. They have a team of financial advisors, CPAs, estate attorneys, Medicare providers, and Social Security experts to help you accomplish your financial goals. Call to schedule a complimentary consultation at 801-566-5058 or visit their website at www.capitafinancialnetwork.com. You can also check out their financial education podcast, The Financial Call, available on Apple, Google, Spotify, and YouTube.